Morning, students. Today, the topic which we are going to discuss is method of assessment. In this, we will going to discuss interview and observation method. Now, today's learning objective are clinical assessment. You will able to understand the meaning of that. Interview as a method or the meaning of interview. Intervening essentials and techniques. What are the intervening techniques? Types of interview questions. What can be the different type of interview questions? Varieties of interview. Different varieties of interviews. Observation. Meaning of observation. Components of observation. Different components of observation. And types of observation. What are the different types of observation? Now, clinical assessment involves an evaluation of an individual's strength and weakness, means a type of evaluation. In that type of evaluation, we evaluate an individual's strength and weakness, a conceptualization of the problem at hand, as well as possible ecological factors, and some perception for all evading the problems. Before a clinical can prescribe a treatment, means before a prescribed treatment will be given to a particular individual, she must first understand the nature of the illness. Before prescribing a treatment, that clinical must understand what is the exact nature of its illness. A clinical capacity to solve clinical problems is directly related to his her skill in defining them, and capacity to solve clinical problems related to that particular individual is directly related to his skill in defining them, means the skill in defining them depends on the clinical capacity, how we define that particular problem. The reversal, the assessment process began with the referral. Questions such as why is Sam disobedient? Means the referral questions will be began with why Sam is disobedient. Why cannot Jamie learn to read like the other children, and why Jamie is having the difficulty in reading while the other children are easily able to learn to read. Clinicals thus began with the referral question. It is important that they take pains to understand precisely what the question is or what the referral source is seeking before giving the prescribed treatment to them. It is very necessary that the clinicals must begin with the referral questions, and it is important that they take pains, means the clinicals take pain to understand precisely what the question is and what the referral source is seeking. What influence how the clinical address the referral question? The kind of information sought are often heavily influenced by the clinical's theoretical commitments. Assessment, then, is not completely standardized set of procedure. The purpose of the assessment is not to discover the true psychic essence of the client, but to describe that client in a way is useful to the reference source, a way that will lead to the solution of a problem, means a way that will help the client to have a solution of its particular problem. The interview. The assessment interview is at once the most basic and the most serviceable technique used by the clinical psychologist. So, the most technique which is used by the clinical psychologist is the interview method. Now, the assessment interview is at once the most basic, means most clinical psychologists use this technique to get the information from the clients, and the most serviceable technique used by the clinical psychologist. The most basic and most serviceable technique that is used by the clinical psychologist. Its wide range of application and adaptability make it a major instrument for clinical decision making. It is a wide range of application, the wide range of application of interview and adaptability and how it's being adapted make it is a major instrument for clinical decision making, understanding and prediction. The art of interviewing, how we can take the interview. What should be the art of taking the interview? Except in the more structured, means it can be in a more structured frame where the number of questions is pre-decided, the questions that has to be asked are pre-decided. Formal interview, there is a degree of freedom to exercise one's skills and resourcefulness that is generally absent from other assessment procedure. Means other assessment procedure that will be used by the clinical psychologist to assess the personality of the individuals. Decisions as to when to talk, when to be silent, when to ask a question from the client, when the psychologist has to be silent, means it has to give time to the client to express his views, or when to be indirect or subtitle test the skill of the interviewer. And these are the skill of the interviewer that the interviewer must learn when to ask a question, when to be silent, when to be indirect or subtitle test. Now, interviewing essentials and techniques. What are the essentials and techniques that are necessary for interviewing? Physical setting. Second, nature of the patient. Third, training and supervised experience. Now, physical arrangement, privacy and protection from interruptions. Means it clinical psychologist must select a place where there should be a privacy and protection from interruptions. Means while he is doing or conducting the interview, he must not be interrupted by other people or other sounds or noise that is coming from outside. The office or its furnishing can be distracting. The place where the interview is going to be conducted, the office or its furnishing, the place of its furnishing can also act as a distracting element for the client while taking the interview. Many clinicals prefer offices that are fairly neutral yet tasteful. So many clinical psychologists, when they are going to adopt the assessment method of interview, they prefer offices that are fairly neutral yet tasteful for the clients. Note taking and recording. A key phrases jotted down will help the clinical records. The important thing, the key phrases that has been used by the client, these things should be noted down by the psychologist. However, any attempt at taking verbatim notes should be avoided except when administering a structured interview. It may prevent the clinicals from attending fully to the essence of the patient's verbalizations. If the clinical psychologist is noting down and recording everything, then what will happen? It may prevent clinicals from attending fully to the essence of patient's verbalizations. So, the clinical psychologist must note down the key phrases and the important thing from the interview. Excessive note taking tends to prevent the clinical from observing the patients. Means if the clinical psychologists are spending excessive time in note taking, and that excessive time spent on note taking, what will happen? It will prevent the clinical from observing the patients and from noticing subtitle changes of expression or slight changes in body position. Now, what will happen if the E will spend time in just noting down what he is saying? It will prevent the observation of the patient. By observing the patient, the clinical psychologist aim to know how the changes of expressions has been made by the client, or what are the slight changes in his body position when a particular question was asked by him. It is easy to audio tape or videotape interview. So it is easy for a clinical psychologist to record the interview. It can be a audio tape or it can be a video tape. Under no circumstances should this be done without the patient's fully informed consent. Means a clinical psychologist must take the consent from the individual before making a record, a audio record or a video record. He must inform the patient that he is going to do so. Now, rapport involved a comfortable atmosphere and a mutual understanding of the purpose of the interview. Involves a comfortable atmosphere means a rapport should be established between the client and the clinical psychologist before they are going to start with the interview. And the clinical psychologist must provide him a comfortable atmosphere and a mutual understanding of the purpose of the interview, and a mutual understanding that this is the basic purpose of the interview. That's why they are going to take the interview. A good rapport can be a primary instrument by which the clinicals achieves the purpose of the interview. If the clinicals able to establish a good rapport with the client, then it will help the clinicals to achieve the purpose of the interview. Now, communication. Beginning session. How a session should be began by the clinicals. Casual conversation. We can start with a casual conversation. What's your name? What you are doing? How you are feeling? These are the casual conversation so that the client may be comfortable and a rapport can be established between the clinical and the client. A brief conversation designed to relax things before pulling into the patient's reason for coming will usually facilitate a good interview. Now, type of interview questions, type, importance, and example. The first type are open-ended questions. Importance, give patient responsibility and latitude for responding. Now, it's giving the responsibility and latitude for responding for the clients to that particular question. Example, would you tell me about your experience in the army? Now, it is the responsibility of that particular client to respond to that particular question, that how his experiences were in the army. Facilitative, encourage patients flow of conversation means with this type of interview question, the clinical is encouraging the patient to flow of conversation, that they express their viewpoints and a conversation can flow up between the clinical and the client. Can you tell me a little more about that. Means, if he start giving the answer that this is my experiences in the army, then a clinical can ask, can you tell me a little more about your experiences? Now that what he is doing, he is encouraging the patient's flow of conversation. Now clarifying encourages clarity and amplification. I guess this means you felt like. Encourages clarity means now the clinical wants some clarity on that particular question, and that is why he is asking that I guess this means you felt like that. Confronting challenges, inconsistencies, or contradictions. Before, when you said direct, once rapport has been established and the patient is taking responsibility, once a perfect rapport has been established between the clinical and the patient is taking the responsibility. What did you say to your father when he criticized your choice? Now, a perfect rapport has been established. Now, the clinical is asking the question from the client, and the client is taking the responsibility to give the answer. Then, what did you say to your father? What was your response when your father criticized your choice? Now, varieties of interview. Intake admission interview to determine why the patient has come to the clinical or hospital. Now, you have to you have to find out why the patient has come to the clinic and the hospital. Second, to judge whether the agency facilitates policies and services will meet the need and expectations of the patient, and to come to a judgment whether the agency facilitates policies and services will meet the need and expectations of the particular patient or not. To inform the patient of such matters as the clinic functions, fees, policies, procedures, and personnel, and to inform the patient. Now, it is the responsibility of the clinical psychologist to inform the patients of such matters at what is the function of the clinic, what is the fee structure of the clinic, what is the specific policies of that particular clinic, procedure, what procedure will be followed, and personal. Now, case history interview. The clinical is interested both in concrete facts. Now, the clinical psychologist is interested both in concrete facts. What are the facts? And these facts should be the concrete facts. Dates, the particular dates on which that thing has been occurred, and events. And these are the particular events and in the patient's feeling about them, and what is the particular feeling of the patient about those facts, dates, and events that has been occurred. It covers both childhood and adulthood, and it's covered when we are talking about the case history interview. It covers both childhood and adulthood, and it includes educational, what is the education, how is the education, from which where he has taken the particular education. All these questions will be asked during the case history interview section. Medical history of that particular individual, from which if he has any medical issues, if he has taken any medical consultation or not. Parental environment, what is the specific environment which was given by the parent, religious, to which religion he is belong, and psychopathological matters. Mental status examination interview is conducted to assess the presence of cognitive, emotional, or behavioral problem. Now, mental status examination interview are conducted by the clinicals of the client so that they can assess the presence of cognitive, emotional, or behavioral problem, whether the patient is suffering or having some cognitive, emotional, or behavioral problems. It is important for clinical psychologists to be familiar with the MSE because these interviews are one of the primary mode of clinical assessment. So, why mental status examination interview should be conducted? Because it is important for clinical psychologists to be familiar with the mental state examination of the particular patient, because these type of interviews, the mental status examination interview, help the clinical psychologist for a variety of mental health professionals including psychology. Primary mode of clinical assessment, because this is the primary mode of clinical assessment for a variety of mental health professionals including psychiatrists. Now, the next one is crisis interview. Increasingly, clinicals have been functioning in novel settings, including store-front clinics. Now, increasingly, clinicals, the clinical psychologists, have been functioning in novel settings, and it's include store-front clinics, telephone hotlines specializing in advanced or comfort to drug abuser, or telephone hotlines specializing in advice or comfort to the people who are drug abuser, to parents who have dysfunctional children, and is helpful for the parents who have dysfunctional children, or to person who are just lonely, and it is also helpful to the persons who are just lonely. The purpose of the crisis interview is to meet problems as they occur and to provide an immediate resource. Now, what is the purpose of conducting crisis interview? The purpose of conducting crisis interview is that with the help of that crisis interview, we are able to meet the problems as they occur and to provide an immediate resources to meet those problems, to deflect the potential for disaster, and to encourage callers to enter into a relationship with the clinic or make a referral. To deflect the potential for disaster, what can be done? And to encourage the callers, the patients, to enter into a relationship with the clinic or make a referral questions to know what is the source of those problems. Now, the next one is diagnostic interview. Structured diagnostic interview means, when we are talking about the diagnostic, means it is able to diagnose what is the basic problem. Structured, all the questions are pre-decided, the number of questions are pre-decided. Consists of a standard set of questions, means it is has a some standard set of questions, and follow up probes that are asked in a specific sequence. And not only the standard set of questions are being decided, but the follow up probes that will be used by the clinical psychologist to ask in a specific sequence are also fixed. The use of structured diagnostic interview ensure that all patients or subjects are asked the same question. Now, what is the use of developing a structured diagnostic interview? The main purpose is that it will ensure the structured diagnostic interview ensure that all patients or subjects are asked the same questions. Now, the next method of assessment that we are going to discuss is observation method. What is happening in this picture? Now, you have to observe what is happening in this particular picture. Be factual. You have to give your answers on the basis of the facts. The facts: the child is standing with her face to the wall with her hands over her eyes. Now, this is the fact that the child is standing with her face towards the wall and he has covered his eyes with her hands. Your opinion is she is crying, hitting, sulking, etc. But you can say that this is the fact that the child is standing with her face towards the wall with her hands over her eyes, or your opinion can be she is crying, hitting, and sulking, etc. Now, observation, the action, it can be an action, or process, it can be a process of closely observing, means an action or a process where we closely, minutely, in a detail we are observing or monitoring something or someone, or we are monitoring something or someone, means it's a way, it's a process of not only observing that thing in a close manner but also monitoring something or someone. Now, definition: observation is a systematic, means a system, a sequence has to be followed when we are going to do an observation, and deliberate study through the eye of spontaneous occurrences at the time the occur. Through the eye means we have to do that observation with the through the eye of spontaneous occurrences, means everything that is going to occur in a spontaneous way at the time they occur, at the time that is occurring. The purpose of observation. Now, what is the basic purpose of observation? The purpose, the aim, or the goal of observation is to perceive the nature and extent of significant interrelated elements within complex social phenomena, culture, and human conduct. So, the purpose of observation is to perceive the nature, to perceive the nature and extent of significant interrelated element. And what are the significant interrelated elements within complex social phenomena, and within the complex social phenomena, culture, and human conduct? And this definition was given by Young. Why observations are needed? The first one is for early intervention. We will able to know early that these are the intervening things. During transaction, when working in partnership, when we are working in partnership to review the environment, or on the basis of the observation we can review the environment to plan for individual children's need, and by observing the children we will able to come that these are the particular individual children need. Now, components of observation. Observation is more or less a process. When we are talking about the observation, we are saying that it is somewhat like a process. It has three distinguishable components, and when we are talking about observation, it has three distinguishable components. And these components are sensation, attention, and perception. Now, the first is sensation. Sensation, the first step in observation. When we are talking about observation, the first step in observation is sensation. Are gained through the sense organs, and through which we are gaining those sensations. We are gaining those sensations through the sense organs. The reliability and fullness of the sensory reactions to the situation depend on how keen the sensory organs are. Now, the reliability and fullness of the sensory reactions to the situation depend on how keen the sensory organs are, and this is why the investigator should be physically in top conditions. That's why we are saying that the investigator who is observing a particular phenomena or an event should be physically in top condition when he is going for his observation. Now, the five senses: the sight, hearing, taste, touch, and smell. Now, the second is attention. Observation is attention, that is investigator subject under study. Means he should be attentively study the subject matter. Concentration is largely you have to concentrate, and in the initial stages a matter of willpower. But adequate training means when you have given a lot of training, experience, experiences were given, and grit could make it almost matter of habit. Now the perception, the third element, perception. Now the third element that we are talking about in observation is perception, how we are perceiving. Comprises the interpretation of the sensory reports. Now, perception involved when we are interpreting the sensory reports, the report that we have got through our senses. A sensation merely reports the facts as observed. Means with the help of sensation we are able to merely report the facts that we have observed. Whereas perceptions enable the individual to recognize the facts by grouping or identifying sensation and drawing upon past experiences, imagination, and thought. How many legs does this elephant have? Now you have to see through the senses how many legs does this elephant have, and on the basis of that senses you we will able to perceive what you have seen. Now, types of observation. What are the different type of observation? Observation can be classified into various types. When we are talking about the classification of observation, we can classify the observation into various types according to the method used and the type of control exercised. According to the method which has been used for observing, first thing, and the type of control exercise. Following are the chief types, means following are the main types of observation. The first one is unstructured observation. The second one is structured observation. Third one is participant and non-participant type. Now first we will discuss about unstructured observation. Unstructured observation refers to simple and naturist observation, means it's a simple and a natural way of observation. In this type of observation, when we are talking about the unstructured observation, this type of observation, no attempt is made to manipulate or control the phenomena. In this type of observation, no attempt will be made to manipulate or to control a phenomena. Observations are is made in the national surroundings and the activities are performed in their usual course without being influenced. And in this type of observations are made in the national surroundings, and the activities are performed in their usual course without being influenced. No one being the observer will not be influenced, or any attempt, or he will not make any attempt to use precision instruments to measure and record facts and to check their accuracy. Being influenced, or any attempt will not be made by the observer to use precision instruments to measure and record facts that has been observing by them, and to check whether these things are accurate or not. This is the unstructured observation, where the teachers are just observing what the children are doing. Now, the second one is structured observation. Structured observation refers to the controlled observation, where everything will be observed in a controlled environment, where mechanical aids for securing accurate data are used, where different aids will be used by the observer so that accurate data can be used or can be collected. Conditions of observation are standardized. The conditions or the situations for observations are standardized, and attempts are made, and attempts will be made by the observer, made to get a representative samples, so that a representative sample can be get, and to correct sampling errors wherever needed, or we can able to collect sampling errors wherever it is necessary to correct those things. And this is a structured observation. Definition of an unstructured interview. Structured interview: what is your work experience? A list of predetermined questions is used. When we are talking about the structured observation, we will use a list of predetermined questions that can be asked uh, for observing a particular event or a phenomenon. Participant and non-participant observation. Participant observation: when the observer becomes the part of a particular group that he is going to observe. Non-participant observer: he is observing the group activities, the group actions from outside. He is not being the part of that particular group. Now, participant observer observation: the researcher observer joins a group. He will join the particular group that he is going to observe and observe their activities. He will join that particular group and observe their activities, what they are doing, while at the same time taking care to observe what is going on. He will not only join that particular group, but at the same time taking care, he will take care to observe what is going on in that particular group. Now the next is non-participant observation. The researcher observer simply observe the activities. In that type of observation, the participant or the researcher or the observer simply observe the activities of the group that he is going to observe, but does not take part in them. But he does not take part in the activities that will be conducted by that particular group. Uh, so, students, today we have discussed about the assessment methods. The first assessment method that we have discussed is the interview method, and the second we have discussed about the observation method. For further reading on this particular topic, you can refer these references. Now let us discuss some MCQs, as MCQs are the best way to know the learning outcomes of the learners, how much they have understand a particular concept. Now, the first one, you are excited about interviewing one of the chief officers of Google. You are told you will only have 15 minutes with this individual. Which type of interview would be best choose? The first one is ethnographic interview. Second one is semi-structured interview, C formal interview, or it's the focus group interview. Students, these are the options. Now you have to select which will be the correct answer or which interview method would be selected by you. Now the correct answer will be option B, that is semi-structured interview will be used by you, or can say would be the best choice to take the interview. Now the second one, which of the following type of interview exercise the least amount of structure and control? Means there are different type of interviews, and you have to select that particular interview style which is least amount of structure and control. The first one is semi-structured interview, B informal interview, C structured interview, or it's D unstructured interview. So students, these are the choices, and now you have to select the correct answer on the basis of the given choices, and the correct answer will be yes, the correct answer will be option B, that is informal interview. Now, the third one, another name for unstructured interview is. What is the other name of unstructured interview? Now, the options are A. Self report, B. Informal interview, C. Ethnographic interview, D. Structured interview. So, students, these are the options. Now, you have to select that what will be the correct answer, and the correct answer will be option C, that is another name for unstructured interview is ethnographic interview. Now the fourth one, you are the mediator for a focus group interview. You began with the question to make your respondent feel comfortable before the actual interview begins. This is options are A. Unstructured interview, B. A structured interview, C. An icebreaker, or it's D. A meditation. So, students, these are the options. Now you have to select the correct one, and the correct one is the option C. That is, this is an icebreaker. Now, the fifth one, the goal of this particular method is to discover four categories and describe the group's lived experiences from the group point of view. It is options are A. Interviewing, B. Case study, C. Naturalistic observation, or it's D. Participant observation. So, students, these are the particular choices, and now you have to select the correct answer, and the correct one will be option D, that is participant observation. Now, the sixth one, which of the following is an advantage of participant observation? Now, the options are A. It is time efficient, B. It's involved non reactive observation, C. It's an objective, D. It helps researcher reconcile what people say they do with what they actually do. So, students, these are the options, and now you have to select the correct option on the basis of the given choice, that what should be the advantage of participant observation. So, the correct answer will be yes, the correct answer will be option B, That is, it helps researcher reconcile what people say they do with what they actually do. Now the seventh one, which of the following is not a disadvantage of participant observation? Means now you have to select a particular advantage of participant observation. Now the options are: there is short time commitment. Option B, difficulties with gaining access to a particular group. C, cultural shock. D, the participant observer own culture bias. So these are the options, students. Now you have to select the correct answer on the basis of the given choices, and the correct answer will be yes. The correct answer will be option A. That is, there is a short-term commitment. So this is not a disadvantage of participant observation. Now the next one. Sherry is engaging in a project in which she is observing owners playing with their dogs in a local park. How owners are playing with their dogs in a local park, he has to observe that. Sherry does not interact with the owners, where the animals and merely blends into the setting without attempting to control the behavior that she sees. Which method is she is employing for the observation? Now the options are: A, participant observation, whether he is doing that; B, naturalistic observation; C, reactive observation; or D, sequential observation. So students, these are the particular choices. Now you have to select the correct answer on the basis of the given choices, and the correct answer will be option B. That is, Sherry will employ naturalistic observation to observe how owners plays with their dog in a local park. Now, which of the following is an disadvantage? It's an advantage of naturalistic observation. Now, you have to tell me that among these choices, what will be the advantage of a naturalistic observation? Now, options are: it's allow you to embrace yourself in people's daily activity. B, it's allow you to record unspoiled behavior. C, it's help you verify your own observations with interview. Or it's D, it help you establish a rapport with the people you are studying. So students, these are the options, and now the correct answer will be option B. That it's allow you to record unspoiled behavior. Now the tenth one, which of the following is not a disadvantage of naturalistic observation? Now you have to tell me which of the following is not a disadvantage of a naturalistic observation. Now the options are: A, you cannot ask questions to verify your observations; B, it is difficult to correlate attitude with actual behavior; C, observer bias; or D, it's provide rich descriptive detail of behavior. So the correct answer will be option D. That it's provide rich descriptive detail of behavior. Thank you, students. With this particular narration, you have understood interview method, types of interview method, essential techniques that are needed for an interview when he is going to take the interview. Then we have discussed about the observation method. What do you mean by observation method? Types of observation methods and different components that are required for an observation method. Thank you, students. Thank you so much for your patience listening.